Good afternoon, everybody, and thank you for joining this information session. My name is Margaret Dempsey. I'm a registered nurse working in the Healthcare Solutions team at APNA. I'm pleased to be joining you from Wadawurrung Country near Geelong in Victoria today, and I pay my respect to our First Nations peoples, their elders past and present, and I extend that respect and welcome to any Aboriginal and Torres Strait Islander people who might be joining us today. So you're here because you've got an interest in learning more about the Digital Health Nurse Transformers initiative. We're going to talk through it for you to give you a bit of an idea about that this initiative. But first, we'll talk about the background to the Nurse Transformers project. So APNA's workforce survey in 2019 identified that nurses were willing to use new digital technologies and tools, but they needed help to make it happen. And roll on to our 2021 workforce survey, it identified the top 3 ways that nurses learn about new technologies. And they are during routine work in clinical settings, from their peers, and through online training. They were the top 3. So with this knowledge, APNA set about strengthening the use of digital technologies by supporting nurses to educate others. And the Nurse Transformers project was born. So are you our next nurse transformer? Do you have the passion for digital health and want to influence others to use digital health technologies in your workplace? So expressions of interest are now open, and that's why you're here, to know a bit more about it, to join our program. The initiative will see you receive and provide digital health training to increase an uptake across primary healthcare settings. So successful nurse transformers will be supported to become digital health champions and change enablers for other primary healthcare nurses. The program runs until the 30th of June 2024, and an honoraria payment of $2,100 is available for your participation of approximately 15 hours across the whole initiative. It's not 15 hours a week, it'll be about 15 hours for the whole initiative. And you can see there the little asterisk, subject to meeting the program deliverables. So who can apply? APNA is seeking a total of 14 nurse transformers, and we're looking for 6 nurses that are working across broad primary healthcare settings. We're also looking for 5 nurses that are working specifically in the aged care sector. And we're also seeking 3 nurses who've already previously been nurse transformers to provide some support and guidance to the new nurse transformers. And we'll call these people the APNA's Nurse Transformer Advisors. So what will being a nurse transformer involve? Nurses will be provided with the opportunity to engage in a series of activities that are aimed to increase the use of digital technologies, and including My Health Record, which is perhaps one of the key drivers of digital technologies in primary healthcare. So we'll have nurse transformers will undertake some online learning modules, and you'll be able to select from a suite of short digital health training modules. And each of these modules are generally about 30 minutes to an hour. And you'll have to complete a minimum of 2 of them. APNA will also host some leadership training and identify leadership principles to assist you to share information and knowledge with confidence. And there's also a digital health self-assessment survey. It's a pre and post program, so it's just a short 3-minute survey that we'll get nurse transformers to do at the start of the program and then at the end. And that'll identify a level of familiarity with the use of digital health tools and technologies. And of course, a lot of these initiatives you'll be able to include in your CPD portfolio. So that's a win-win for you. Educational activities. As I said, nurse transformers will create opportunities to share digital health knowledge and education with others to increase the uptake and the adoption of digital health behaviours. So educational activities might include a semi-formal in-service sessions at your workplace. It might include teaching others to access My Health Record or find out when a GP management plan's been last billed, to view a patient's list of medications and immunisations. It may include showcasing the benefits of the My Health app or uploading shared health summaries or event summaries. It's about sharing knowledge with others that are perhaps not currently using the system. You might even consider expanding out of your workplace setting, and these activities might include participating in education sessions hosted by your PHN or other opportunities to share information. APNA will provide a activity tracker, and we provide that link to each nurse transformer. So it's a link to an online platform which you'll just be able to fill in and complete, push submit, and that data heads straight to APNA. So we're looking for the ripple effect of nurses teaching other nurses. As I said, if you look back at that initial PowerPoint slide, nurses learn best from learning in their clinical setting by their peers or through online education were the top three. So as I said, we're looking for that ripple effect of nurses teaching other nurses, and the activity tracker is used to document those activities that you undertake. We also will offer some networking opportunities. So there'll be monthly online meetings via Microsoft Teams. We have a community of practice, which is an online platform where you can ask questions, share learnings, offer practical examples of using digital technologies. So to be able to share those learnings with each other as nurse transformers. And during any discussions we have, we'll document any kind of case study scenarios, any issues that you have and how you've been able to work through them. And by documenting these real issues, we can report them to the Australian Digital Health Agency to find practical solutions. So the Digital Health Agency, they want to hear from nurses. They want to hear what's not working, because it's great to be able to hear what's working, but they need to know perhaps what isn't working so that they can make improvements. And they'll be using the Nurse Transformers initiative and liaising with APNA to find out those issues. Throughout the program, APNA also runs Nurse Digest webinars, and Nurse Transformers will be invited to contribute to these online educational webinars hosted by APNA. The educational content is delivered by staff from the Australian Digital Health Agency, and the webinars are enhanced by the Nurse Transformers providing some real examples and practical solutions which are relatable to the audience. So the webinars, the dates are listed on the slide, you can see there. They run for 30 minutes, Melbourne time, from 12:30 to 1 o'clock. And you're actually all welcome to attend. And the first one is on next week, the 7th of December. So if you can scan the QR code that's on the screen, or Alicia might be able to add the registration link into the chat, because so as I said, it's an education session. You're welcome to come along to the first one. And thanks, Alicia, for your support. The registration link is now in the chat, but you can also scan the QR code if you're wanting to register for that event next week. The application timeline and process. So expressions of interest are now open, and they'll close at 11:59 p.m. on Sunday, the 3rd of December. So really you've got through this week. The scoring panel will then assess the applications through the week starting the 4th of December, and then we'll be notifying the Nurse Transformers and Nurse Transformer advisors in the week commencing the 11th of December. And as I said earlier, the program concludes on the 30th of June, 2024. And this information is also available on APNA's Digital Health webpage. And Alicia's added that to the chat. So that is a brief summary of the initiative. I'm going to open the floor now. So if you've got questions, you can type it into the chat box below, or you also are welcome to come off mute and and ask your question. So I can see a question there is a separate EOI for advisors. No, there isn't. Just utilize that EOI link that's there, because of course I know who is a previous nurse transformer applying. So please consider applying and just use the same link. Does anyone else have questions? Let's see. Okay, I'm looking through the questions. Are we just talking about My Health Record or other systems such as Proda and My Aged Care? My Health Record is a key driver, and we're wanting people to better understand the use of it and utilise that system, because it is it's a national system, as you know, and it's a repository for a person's healthcare information. And so therefore, regarding whatever setting they are in, information can be found by accessing someone's My Health Record. But utilising this Nurse Transformers initiative to distribute information, spread information is absolutely relevant. And Nurse Transformers will be able to put that information in that activity tracker to show what they've been doing. So My Health Record, a key driver, but other digital technologies as well.